So my name is Ann Posey. I work at Cleveland Clinic Indian River Hospital. I'm a licensed mental health counselor by training, and I'm an administrator for behavioral health at Cleveland Clinic Indian River. In behavioral health, we see a lot of people who are struggling with mental health challenges, whether that be from an illness that they've suffered with throughout their lifetime or from recent stressors that they may have experienced. At Cleveland Clinic, we have several modalities which we can help people. We have an inpatient hospital where people can be treated if they're in a crisis situation. With the support of United Way and several other funders, we have a intensive outpatient program that treats adolescents, trying to keep them either out of the hospital or, helping them if they're having more problems than they can treat in traditional outpatient therapy. We also have a telepsychiatry program in our emergency rooms where we can evaluate people who are in crisis and recommend the appropriate level of care. We see a broad spectrum of patients or clients or people with mental health struggles. We actually treat from the age of 5 to 105 is what we say. So we may see children who are struggling with the stresses of school or family. We may see young adults or adolescents who, are struggling, or adults who are facing challenges. Some people may have a challenge of dealing with depression or anxiety. Other people may have had a lot of difficulty dealing with the stresses around the pandemic. There are people with more severe and persistent mental illness that will require care, such as, bipolar disorder or schizophrenia. So we really treat a broad range or broad brush of mental health challenges. If someone is experiencing some type of crisis, we can probably point them in the right direction to the type of help they need. I always like to remind people that recovery is not only possible from mental illness or mental health challenges, it's probable that the majority of people who face a mental health challenge do get better. They do recover. We see many people, who sometimes are in the depths of despair, maybe feeling like they want to end their life or feeling like things aren't worth living. And when they get that help and recognize that they aren't alone, they come out the other side and probably in some respects stronger for it. And then a lot of times those people are willing to help others. There's a program in Florida where people who have lived experience with mental illness can become certified peer counselors, and they can help other people, who are in the beginning of their journey with mental illness. We use that in our emergency rooms. We partner with the Substance Awareness Center. So someone coming in on maybe having had a drug overdose, we can call one of those certified peer counselors who will come out and see them in the moment in the emergency room and say, I've been where you are, and you can see that recovery is possible and recovery is probable. Community partnerships and collaborations are hugely important. It's one of the things I love about United Way, is that it really is about community and about collaboration and about agencies working together, and putting our money, in common buckets for the common good. I've been a board member just about a year. I think I just had my first annual meeting. I love being part of making my community better. It's something that's really important to me. So being a board member has been, really fantastic for that. So I've been a United Way contributor and donor most of my work life. I have always given my fair share. A portion of my paycheck goes to United Way. It's always been something I've supported, but I don't know that I ever knew exactly what those dollars did. So being part of the Citizens Review, where we could look at these agencies, and it's a very very thorough review. We're looking very critically at these agencies to make sure that the monies are being utilized appropriately, that they're being spent as they're intended to be spent, that nothing is being wasted or not used appropriately. And then hearing about all the good work that they're doing. It's unfortunate. Many people go years struggling with depression or anxiety without getting help. We wouldn't do that if our leg was broken, if we were having chest pain. We would seek out help so that we could recover. But I think because of stigma, many people wait a very long time and suffer needlessly before they get help for their behavior, whatever is going on with the mental health challenge. And there are people out there that can help and can help shine a light in that dark place that they're in. And so I would encourage them to reach out. There are many, many agencies, many funded by United Way, where they could reach out and get that help and assistance and just, reach out.